Hi, Joel. Thank you for joining us here at the Virtual Patient Symposium. I'm so grateful to be able to chat with you. So, for our audience who may not be familiar with you or your story, could you briefly tell us about your experience with kidney cancer?
Well, I was diagnosed on November 18th, 2020. I am a sports fanatic and play a lot of tennis, and my left hip was killing me for a while. And after my wife convinced me you need to get it checked out, I had an MRI through an orthopedic of my back, and much to my complete surprise and shock, they found a 9 centimeter tumor that was destroying my iliac bone, which was suspicious for metastatic cancer. After a whole bunch of scans and blood work and more scans, I was diagnosed as a stage 4 renal cell carcinoma patient with a very small tumor in the kidney, not doing any damage except for
Mm.
spreading in the bones. And I have bone cancer primarily from the bottom of the base of my skull to my lower left hip. And that little kidney tumor that wasn't doing anything finally was removed 18 months later. But I've been on immunotherapy. I have something called oligoprogression, which means we have 2 to 3 things that happen almost every 6 months. And instead of changing the therapy, they whack them all and get
Mm.
radiation. I've had 3 rounds of radiation. I've had cement put in my pelvis, and I've had a CT radiofrequency ablation. But I will tell you, 4 years into it, and I feel very blessed to be alive and here with you today.
Well, we're grateful to have you with us as well, and we're grateful that you're here and you've been such a strong supporter and friend of the KCA. And you had touched on it a little bit in your answer, but I wanted to go over what were your reactions when you heard that you had kidney cancer? Like, what were you first experiencing, and then throughout, the first year of treatment?
Well, I'm a control freak and I had to give up control. And I will tell you that the stages of cancer are true. So my first reaction was complete shock. And then after a few days, I was extremely angry. I never asked why
Yeah.
me, because that suggests it should be somebody else. But,
Right.
I was just so angry. Then I went into a melancholy stage, sadness and depressed. And I've never been depressed in my life, but I was depressed. I thought I would make it till Christmas. I thought I'd never see my one grandchild grow up and other grandchildren. I violated the #1 rule of being diagnosed. I went to Dr. Google and saw all the statistics for stage 4, which are mostly outdated,
Yeah.
wrong, or misleading. And the worst part of it, Anna Maria, is I sat on the couch wallowing in self-pity for the first couple months, and which was very unlike me. I am an optimist typically, but I just couldn't get over the fact that I had stage 4
Yeah.
kidney cancer. And I know, Anna Maria, if you ever watch TV and somebody's sick and they have cancer and they all go, she has stage 4, and everybody goes, die, like
Hmm.
the end of life. And that was my feeling back then. I'm proud to say it took me long enough, but after the first couple months, I got up on my feet and I said, this is crazy. I'm going to fight this thing with everything I have. And I've been fighting ever since. And I look at the world very differently. I look at it like, why not me? Why can't I survive? Why can't I beat the numbers? And every time I have progression, it's let's get through it rather than I'm going to die. And what I always tell people, Anna Maria, is everybody has a death sentence, and it starts
Yeah.
the day we're born. And I consider my stage 4 cancer a blessing in one respect, that every day I'm doing well, I appreciate probably much more than the healthy people. And I'm sure you can appreciate that as well.
Absolutely. I was going to say thank you for saying that you're a control freak, because I am absolutely the same way. And it's hard when you get a cancer diagnosis, no matter the stage, no matter how many times, there's a certain level of control that you have to give up. And if you're someone who's very much like, I need to make sure my life plays out a certain way,
Yeah.
otherwise anxiety just goes through the roof. Cancer really throws a wrench in your plans in that way. Now, in terms of support, as you're going through all of these very natural emotions for a cancer diagnosis, what support resources did you have to lean on?
Sure. I have a great family and friend network, but I kept a lot of it to myself for a while, which is part of the problem because I think it's very cathartic to share the story. But I found the kidney cancer website, which is absolutely incredible and gets better every day. The new section on recently being diagnosed, the patient's stories of fight and survival and beating this disease, how to find a doctor were all very helpful. In addition, I found renal cell carcinoma Facebook communities, which were very helpful. They were private, no politics, no religion,
Yeah.
just focusing on the disease, how we can fight it, what can we share about treatments, about clinical trials. As you probably know, I then started my own stage 4 renal cell carcinoma Facebook community. I'm proud to say we have over 2,300 people now. And I am very biased, but I consider it one of the best communities around. The other thing, Anna Maria, is when I was first diagnosed, I was asked to sign a piece of paper and it had a checkbox and there was curative, which I wanted to see checked, but then there was palliative care, which was the box I was told to check. And that term scared me. Oh my God, hospice, end of life. I'm not going to live. Took me a long time to appreciate that palliative care is so much more than hospice. I've been fortunate. I've taken advantage of everything my hospital and palliative care has to offer, including nutrition, including pain management, including therapy. Again, for the first time in my life, I had to deal with depression, and it takes courage to acknowledge that. So I got help through palliative care. So one of the things I tell people more than anything is don't be afraid of palliative care. It's there to help you live longer with less pain and less side effects, with a better diet, and hopefully get your brain in the right frame of mind to beat this disease.
I'm grateful you brought that up because it also made me think of in the top of a conversation talking about, the media and always framing cancer, no matter what, in this very like death sentence type of way. And I think it's the same thing with the term palliative, is that we need some type of just like reimagining of these words and reimagining of cancer, because I think, when you hear palliative care, if you're not aware of what it is and the wide breadth and range of it, you are going to automatically think hospice when that's not what it is at all. And the same thing with seeing cancer on the media. Not everyone's gonna die from it. Not everyone is gonna die within the 18 months. It's one of those things where we need to reframe cancer. Now, you had brought up that you're a sports fanatic and that you love tennis and your hip was hurting you. Did you have you gotten back into sports since, over the 4 years? Is that something that you were able to reconnect with?
I'm happy to say that I played tennis, doubles with an older group of people. So my level of tennis has gone downhill a little bit, but I still get out there. I was just there yesterday. I play golf. I'll throw the football with my grandsons. Sports means a lot to me. Now, I will tell you, since my diagnosis, I've had 2 progressions where I was sedentary and on way too much oxygen, was in bed and I couldn't do it. And I thought I'd never play tennis again. I've now been wrong 3 times. So I am back on the courts and enjoying myself. Just maybe I'm playing with 50, 60-year-olds rather than 20 and 30-year-olds, but that's okay.
And that is perfectly fine. I mean, fitness is not an age. I really, truly believe that. I'd love for you to talk about more of like that, what you talk about in terms of palliative care, of like staying healthy, nutrition. What has that experience been like? What have you been able to change? What have you been able to adjust to and to get to where you are today?
Well, going back to Google, I mean, if you go on the internet and try to find all these books that tell you your cancer is being cured if you do this diet or this diet or this diet, I mean, my opinion is that's just not true. And other doctors and hospitals, including MD Anderson, have kind of confirmed that. But moderation is the key. So I am a sweet person, a meat person, a processed meat person. I have learned to eat more vegetables, more fruit, less processed foods, less red meat, more chicken and fish. And I think that's been very helpful. I think physical therapy has been very helpful because I have pain. So I will never get rid of that pain. My back is full of lesions. My iliac is destroyed. But learning to deal with pain and also attitude, the attitude that I can do it, rather than I can't do it is critical. And all of this was facilitated through palliative care. I always tell people to think of palliative care as a house with many different rooms. And there is that hospice room, but we're not talking about that. And I hope I never have to talk about that. But there's the nutrition room, the side effect room, the pain management room, so many benefits to be received from that. And the sad thing, Anna Maria, is including on my Facebook community, every day I hear people saying, what is palliative care?
Yeah.
Or I thought that was hospice, or I'm not going to do it, or I can't afford it. When the reality is it's typically covered with the oncology. I've never seen a bill. And there's very little downside to taking advantage of it. So I think all of that has helped me have the right frame of mind to increase my physicality. And I also know my own limits. So if I used to play tennis 4 times a week, I'm probably down to 2.5. My golf swing is a lot more arms than swinging the hips because my left hip, is in really bad shape. So you learn to adjust, and people always talk about quality of life. My quality of life is different now than it was before my diagnosis, but I'm flexible, adaptive, and I've adjusted, and I have quality of life. I just acknowledge there's certain things I can't do as well or can't do at all that I used to do, and I'm okay with that.
I would love to know any advice that you have for our listeners out there who are going through this experience as well.
Number one, this battle, whether you have stage 1 or stage 4, is a marathon, not a sprint. And I'm guessing, Anna Maria, you're a sprinter, because I am.
Yes.
And I always wanted to get to the finish line as quick as possible.
Mm-hmm.
It's disease, there is no finish line. You just got to keep fighting, and you're going to hit fatigue at mile 19 to get to 27. You just got to keep fighting, not give up, know there are curves in the road, and keep getting through it. Number 2, it's not one of my virtues, but I'm getting better. You have to have patience, because you don't get answers within 24 hours of some of the things you're dealing with. So patience is a virtue, but a necessity. Number 3 is you need to stay hopeful. I was happy that I've been telling the world this, but it's great when I hear doctors saying that attitude is correlative to overall survival. That doesn't mean that if you have a great attitude, you're going to live forever. And it doesn't mean if you have a bad attitude, you're going to die tomorrow. But there are studies showing that if you have a positive attitude, you see the glass is half full, that's going to help you in your battle to survive. In addition, you need to be your own best advocate, and knowledge is power. We have so many people that put 100% of their faith in their doctors, and they don't ask questions, they don't challenge, they don't probe. It's critical to understand your disease and to challenge the doctors, because they're not always right. I talked earlier about having a great support network. If you don't have one, find one. In Facebook community, closer affiliation with the Kidney Cancer Association, other communities can help get you there. The other thing, and I'll end with this, is I learned when I was first diagnosed to make a bucket list of things that I wanted to do. And people always ask me, oh my God, you're dying, you created a bucket list. Mm-hmm. And I tell them, no, I didn't make a bucket list because I'm dying. I made one because I'm alive. And I wish I had done that 35 years ago. Every one of us should create a list of things, big or small, money or no money, that we want to accomplish, and check them off, because that gives you hope, and that gives you the faith and optimism that you're going to check these items off in the years to come.
Yeah, I love that. I think that is just so important to really understand that a bucket list is not something that you do because you may be dying, but because you are living. Well, thank you so much, Joel. It was a pleasure chatting with you.